Dr. Sandra Lindsay, Director of Patient Services at Northwell Health, Mr. Jason Chernock, the Director of Programs and Partnerships at MedShare, who joins us online, Mr. Courtney Cephas, the Executive Director of Philanthropic and Mobilization Services at the Ministry of Health and Wellness, Phyllis Hall, Coordinator, Health, Full Life and Wellness Foundation, who joins us online as well, Mrs. Camille Wallen-Panton, the CEO of the Bustamante Hospital for Children, Dr. Micheline Richards-Dawson, the Senior Medical Officer at the Bustamante Hospital for Children, Mrs. Beverly Senior Berry, the Director of Nursing Services here at the Bustamante Hospital for Children, other distinguished guests, members of the media, ladies and gentlemen, those who are joining us online, especially from the diaspora, and all our special guests, a very hearty Jamaican good morning to you. And for all those who are joining us here, because we have an online team, may I ask you to just wave and say a hearty Jamaican good morning. Thank you so much for joining us. This is really a very, very pleasurable and honored function this morning, because this started sometime, Prime Minister, in 2020 or 2021, upon meeting Mrs. Dr. Lindsay, and the Prime Minister, I'm sure, will tell you the interesting story when he met Dr. Lindsay. But here's a little background, because Northwell Health, one of New York's largest healthcare providers, contacted the Office of the Prime Minister to assist Jamaica by way of a donation of medical equipment in response to the COVID-19 pandemic. A meeting was convened with representatives of Northwell Health, the Office of the Prime Minister, and the Ministry of Health and Wellness, along with the Ministry of Foreign Affairs and Foreign Trade. And there's someone in the audience who really pushed through to make it happen. Again, the stories will come very shortly. And this, of course, resulted in the preparation of a consolidated surge list. Now, following submission of the list to Northwell Health, a shipment was selected of the selected items was prepared through MedShare, a non-profit organization which sources and directly delivers surplus medical supplies and equipment to communities in need globally. Now, over 1 million assorted PPEs, N95 masks, face shields, and other items, along with oxygen concentrators, have been donated by Northwell Health and MedShare. Can we give them a round of applause, please? And so to share a little bit more, we have online, he couldn't make it to Jamaica, but I'm sure his heart is right here with us. And I will tell him that it's nice and warm and not so sunny, a little cloudy, but it's nice and warmer than where he is right now. Mr. Michael Dowling, the President and Chief Executive Officer of Northwell Health, who will tell us a little bit more about the donation this morning. Mr. Dowling.
Thank you so much. Thank you very, very much. I'm delighted to be with you. And obviously, the weather down there, as you mentioned, is a lot nicer than it is up here in New York. And hopefully sometime in the near future, I will get to Jamaica to meet you all in person. But I'm delighted that Northwell could be of assistance here. This is what we should be doing always, to help each other, especially when you're in a crisis like COVID. The cooperation that is necessary for each of us to help each other is the only way that we can successfully deal with issues like COVID. And I'm hoping that this what we've done here mutually together is the first of what we can continue to be doing going forward. And I want to say a special thanks to a very, very special person, and that's Sandra Lindsay. Cassandra came to me about this. And as you know, Sandra is an extraordinary individual, very famous these days in the United States. I mean, she was the first person, as you all know, to get the vaccine. I'm sure you're going to talk about this. The first person in the United States. And she's been a phenomenal ambassador for Northwell and an ambassador for nurses and an ambassador for Jamaica. And she's an excellent caregiver, wonderful critical care nurse. And so it's my real pleasure to have Sandra on our team up here. And I know you're obviously very happy to have her on your team down there. So Sandra deserves an awful lot of credit for this because she came to me and we like to be helpful to the extent that we possibly can. So it's a pleasure of mine to be here with you today for this event. And I want to say congratulations to everybody. Congratulations to all the leadership in Jamaica for making this easy. And I also want to say special thanks to MedShare for participating in this with us. We work with them on an ongoing basis. So again, I know you have a long program, and I just want to say on behalf of Northwell, on behalf of all of our employees, many of them who are Jamaican, on behalf of all of us who are working each and every day to deal with COVID and provide the best healthcare that we possibly can to everybody in our communities, we are delighted to be able to participate. And my congratulations to all of you. And let's hope that we will continue to work together to do more good things. And so with that, let me turn it back to you. And during the course of this coming weekend, I'm going to be fantasizing about the wonderful weather in Jamaica. And I'm going to try to imagine being there. But at some point in the near future, I hope to make a visit. So again, thank you very much. We're privileged at Northwell to be able to work with you on this. And it's what we should all be doing together, as I said at the beginning, when we're dealing with a crisis like COVID and other disasters. So all the best to all of you. And thank you so much for having me on for a few minutes. Appreciate it. Thank you.
Thank you so much, Mr. Dowling. And yes, we are sending you virtually the warmth and love and hug that is so synonymous with Jamaica. And a little bit of reggae music to top it off. It's our reggae month here in Jamaica as well. Thank you so much, Mr. Dowling. May I take a moment as well to acknowledge the presence of Dr. the Honorable Kenny Benjamin. Mr. Benjamin is actually the chairman of the management committee here at the Bustamante Hospital for Children. Thank you so much for being with us, Mr. Benjamin. You know, today speaks to the power of the Jamaican diaspora. When Dr. Sandra Lindsay met the Prime Minister in a courtesy call last year, one of the first things she said to the Prime Minister is, how can we help? Being the first person to take the COVID vaccine, she was critically aware of what culturally was happening in Jamaica and on the ground with some resistance. And she knew it as well, what was happening with needs to deal with COVID. And her first line, or one of the first lines, was, how can we help? So thank you, Dr. Lindsay, for your hard work and for championing the cause of Jamaica. Another man who champions the cause of Jamaica and certainly health and wellness is our Minister of Health and Wellness, Dr. the Honorable Christopher Tufton, who will come and say a few words to us now. Dr. Tufton.
Thank you very much, Madam Master of Ceremonies, Ms. Naomi Francis, Honorable Prime Minister Andrew Holness. Thank you very much and welcome again, sir. Seems when you come to Bustamante, you bring good tidings and great joy, given that we were in this room the last time and you had very good tidings that you were presenting to us and to public health. Dr. Sandra Lindsay, Director, Patient Services, Northwell Health, and may I dare say, International Ambassador for Public Health. Good to see you, and an amazing outfit that you have on there. I don't normally comment on the outfit, Prime Minister, but the color in particular is really lovely. Mr. Jason Shernock, Director, Programs and Partnership, MedShare, Chairman of the Bustamante Hospital for Children, the Honorable Kenny Benjamin, good to see you, sir. Mr. Cephas, Executive Director of our foundation, who is here and who played a very important role in organizing this event. Phyllis Hall, his worthwhile deputy, and Ms. Camille Panton, CEO, Dr. Dawson, SMO, and shall I just say, the family members of the Bustamante Hospital for Children, one and all, members of the media. Thank you very much for this opportunity to be here. Thanks to the team here at Bustamante Hospital for Children for organizing this short event, but nevertheless significant event, very, very important. So the last 23 months of the COVID-19 pandemic have been challenging as we have worked to save lives. while continuing to protect our family, our friends, and indeed, as the Prime Minister spends so much time explaining, to manage livelihoods. That we are now seeing a decline in the daily number of infections and hospitalization as we come out of this fourth wave. And I looked at today's positivity rate. It's 17%, I think it is. We're now trending. Remember, we're coming all the way from 60%. So we are moving in the right direction. It is evident and sufficient evidence that the team on the ground, the government of the day, led by the Honourable Prime Minister, the medical team, the healthcare frontline workers, Ministry of Health, have been doing a sterling job, I think, to protect the lives and the livelihoods of Jamaicans. And I really want to just place on record how important that is. It's also evidence to support, and this is why we're here, the public-private partnerships that have really strengthened our resolve and our approach. And in this instance, Dr. Lindsay, the diaspora and those persons who are either Jamaicans or friends of Jamaica who have really galvanized and organized themselves to contribute to this cause. Really want to salute them and to thank them. So today's donation of $800,000 in medical equipment and supplies by Northwell Health in collaboration with MedShare is an important and another manifestation of that support and that partnership. We're thankful to the Northwell team headed by Mr. Dowling and to MedShare for their partnership. And we want to acknowledge again you, Dr. Lindsay, for your role in making the donation possible. Northwell's donation, including oxygen concentrators, face shields, cannula, nasal oxygen, assorted mask, N95, filter respirators, could not have come at a better time, in that while we are seeing the back of the fourth wave, we want to also use the opportunity to send a very strong signal that COVID is still with us and still represents a threat. I know some people are impatient of that advisory and would like to see the back of us saying that. The truth is, it is still here, and it is our duty as a responsible government, as a ministry, and indeed as a hospital, and as partners to reinforce that message, even while we see the progress that we are making. So we want to say thanks. The donations today complement our ongoing efforts to keep the public safe, from preparation to ensure adequate supplies of oxygen and other critical equipment to support the work of the personnel in the field. Let the partnership continue. It is important that as the world heals, we support the healing of one citizen at a time, one nation at a time, one community at a time. And I think this donation and partnership today is an example of that. Thank you very much on behalf of the Ministry of Health and Wellness.
Thank you, Dr. Tufton, and I think you can add a little bit of comedy in terms of your repertoire that you bring every now and again, right? Soon to be a comedian. Thank you so much for your brief but very important intervention. So we keep calling her name, but for those, especially those who are online, Dr. Sandra Lindsay, may I ask you just to stand for us and just wave to the camera for a minute? Because so many people, there are so many conspiracy theories going around about vaccination. And so many people are saying, boy, you know, it's not real, you know, it has this or that. She's still around, healthy enough to be leading the cause to galvanize support from those overseas to help us in Jamaica. So all these conspiracy theories that have no basis, you know, here she is, living testimony of the fact that the vaccines work. And that is testament to the fact that, you know, we in Jamaica, we've been able to get the vaccines available to our people. Take the vaccine. The Prime Minister may be a little shy these days to say it, but I'll say it. Take the vaccines. No, the last time he said, I'm not going to tell you, just go on. No, but it's true. Take the vaccines, ladies and gentlemen. It's important, in addition to all the other safety measures that you must deal with to manage COVID-19. Ladies and gentlemen, it always gives me great pleasure to introduce the Prime Minister of Jamaica, the Most Honorable Andrew Holness. He comes with not just the on-paper acumen of being a good leader, but there is also an element of his leadership that I don't think he talks about, nor many people talk about, the aspect of caring. Dr. Tufton alluded to it not too long ago. The Prime Minister, in seeing what was happening, personally led the way through his foundation to donate some oxygen concentrators last December, was it, Prime Minister? Because of the need that is there. He's leading from the front, not because he's Prime Minister, but because he cares. Because when we talk about building our Jamaica, these are practical things that he shows every Jamaican that can be done to making the space here in Jamaica better. Do what you can. And he always say, do something. And he has been doing something, leading from the front in terms of the COVID-19 management and leading the country in making sure that we all work together in creating and building our Jamaica. Ladies and gentlemen, the Prime Minister of Jamaica.
Thank you, Madam Master of Ceremonies. Naomi, I don't know where you got it that I was shy in telling people to get vaccinated. No, I have seen the pressure that Dr. Tufton was under recently, and I decided to allow him to handle it. Having been handling it for a very long time myself. Of course, you know, we're all humans and we all have to sometimes just take a little break. But we are never out of the fight, and we are never weary in doing good. And what is right, even if it is not popular, we will continue to promote what is right. Respecting, of course, that this is democracy, this is a free country, and we respect people's opinions, but we know that opinions are not facts. And so if you are factually incorrect, then we will seek to bring you to the point of what is correct. And so we will continue to promote vaccination as a solution. Let me acknowledge formally the Honorable Christopher Tufton, our hardworking Minister of Health, Mr. Michael Dowling, President and Chief Executive Officer of Northwell Health, Dr. Sandra Lindsay, Director of Patient Care Services of Northwell Health, Dr. Michelle Ann Richards Davidson, Senior Medical Officer of the Bustamante Hospital for Children, Mrs. Camille Wallen Panton, Chief Executive Officer of the Bustamante Hospital for Children, members of staff of the Bustamante Hospital for Children, and members of staff of the Ministry of Health who are also here, members of the media, distinguished ladies and gentlemen, it is indeed a good morning. And you will permit me, just for clarity, to temporarily remove my mask. Let me start by saying how pleased I am to be here at this ceremony to receive this very kind donation of much needed medical equipment and supplies from Northwell Health. Since August 2021, Northwell has made 2 shipments of critical equipment and supplies: respirator masks, N95 masks, oxygen concentrators, safety eyewear, protective gowns, and more, valued at over 800,000 United States dollars. I think that deserves a clap, don't they? Don't be hesitant in that. I want to thank Northwell Health and their logistics partner, MedShare, for their tremendous support I also want to recognize and specially thank our own Dr. Sandra Lindsay, with whom this entire initiative started. Dr. Lindsay made history on December 14th, 2020, when she became the very first person to receive a COVID-19 vaccine in the United States. And you're still alive and well, despite all the conspiracy theories to the contrary. She has been a shining example of exemplary civic service and has been promoting the message of public health and the importance of vaccination. She was honored by President Biden as an outstanding American by choice during a special naturalization ceremony at the White House. This initiative had its genesis during a visit to Jamaica in 2021 by Dr. Lindsay in the midst of our second wave. She absorbed, or rather she observed, the significant need in terms of supplies, and she made it a commitment that she would assist, and expressed this commitment to a friend of hers who was at the time interviewing her for his TV program, and many of you would know him as Dwight Peters. And she, during the interview, asked what channels could we utilize to assist. Mr. Peters took it upon himself to make some contacts. And of course, upon your return, Dr. Lindsay, to the United States, you brought the need to the attention of the leadership of Northwell. And as they say, the rest is history. So we are here today. One of the most important lessons of the pandemic is that we are all in the pandemic together. No one country is safe from another country. And if you brought it down to the community, you know, your neighbor is not safe unless you are safe. We're all in the pandemic together. And what it means is that those who have resources, who have vaccines, who have supplies, it is also in their interest to share as much as possible. So we are appreciative of this very enlightened approach and this enlightened consideration by our friends and partners from Northwell Health. I therefore want to commend and thank Northwell's leadership for being receptive to Dr. Lindsay's call to provide support to Jamaica. And I was pleased to learn that this aligned very well with Northwell's own vision to be a catalyst for growth and development of the global health infrastructure. And I note that Northwell has similar collaborative initiatives with countries such as India and right here in the region with Guyana. So again, let me thank the leadership of Northwell, and I would certainly give them a rousing Jamaican round of applause. The pandemic has exposed the inherent weaknesses in our health system, not just locally, but across most developing countries. We in Jamaica are embarking on the most significant and I would say ambitious upgrading of our healthcare infrastructure since our independence 60 years ago. The multi-year plan will see upgrades to 13 health facilities comprising 3 hospitals and 10 health centers across the island. In addition to healthcare infrastructure, we will need world-class training and development opportunities for the next generation of healthcare workers, and we are making that significant investment. Recently, Dr. Tufton and the team from the Ministry of Health put on a symposium and a virtual tour of what these new facilities would look like, and it was quite impressive. I raise this here today because there is, in the pandemic, many differing views being brought into the public arena. Some views stand the test of reason, and unfortunately, many don't. There is a perspective being shared that the strategy of the government should have been to prepare for COVID. And if you take it to the logical conclusion of that proposition, the argument would go something like this, that the government should increase its healthcare capacity to fight COVID so that it does not have to rely on non-clinical measures to control COVID, meaning that increase the healthcare system and abandon the various health controls. It sounds logical, and it's a reasonable proposition to an extent. Now, when the pandemic started, the government made massive investments in providing dedicated bed space and diverted healthcare attention from other areas of need to focus primarily on tackling this novel virus to which we were naive. Now, we rapidly increased our beds. We brought on more doctors. We brought in ventilators. We did all that was possible within our budget. Now, if you're going to talk long-term increase in your capacity, now that could not happen during the pandemic. It takes at least 5 years from design to breaking ground to put a proper hospital in place. We were able, through partnerships, to get field hospitals in. But those, even though they immediately assist, they are really very temporary. And you would not consider them a permanent increase in the capacity. So, yes, the government did increase its capacity. But with the pandemic, you will never be sure as to exactly what will be the demand on the capacity. And with a virus to which our immune system is naive, we have never experienced it before, potentially everyone in Jamaica could be infected, and a significant percentage could develop symptoms, and of that, a significant percentage could develop the disease of COVID-19. And therefore, if we just allowed, everybody to go about as normal because we had capacity, what you could face, or what we could have faced had we pursued that path, would be a terrible overrun of the capacity that we have built. So the argument breaks down when you get to the point of the infections rising, when you get to the point of a surge. And you would have seen that no matter how we increase the capacity, when you get to the point of a wave turning into a surge, heading into a peak, by definition, at a peak, you're always going to be above capacity. So you can't pursue a strategy primarily and alone, singularly, of just increasing capacity, right? You have to have the other clinical and non-clinical measures to contain the spread of a novel virus. But in saying all of this, we come to another point in the argument that we must acknowledge. We cannot continue with the non-clinical and clinical measures forever. Certainly with lockdowns, curfews, restrictions on movements and gatherings. This is not a permanent solution. And we have carried it for a very long time. And I can understand the frustration that is building up in our little society, Jamaica. A society that is already challenged with the historical fault lines of injustice and social preference, the extreme poverty and inequality. And when you layer on top of that restrictions, which make it worse for those who are already worse off, you can understand the frustration of the Jamaican public and how that frustration has created a negative mood in the populace. Now, mood is a very important element of governance. You can't pretend that you are in a dictatorship and whatever you say goes without paying attention to the mood of the Jamaican people. And right now, I've said it before, this is the summer of our discontent. It is. With prices going up, this has nothing to do with how the government has managed the economy. This is a total, what economists would call an exogenous shock, a shock caused by a pandemic, which is out of, we have nothing to do with the pandemic, but it's an external shock, which has led to some economic shocks on the commodities market, shocks on the energy markets, shocks in logistics, shipping and transport. And that is causing prices to rise locally and companies seeking to readjust. Poor consumers, how are they going to manage? We, as a government, have tried as best as possible to redirect tax resources into social care programs. And we have done, I believe, exceptionally well. Never before in the history of Jamaica has any government done the social care and social safety net programs that we have done. And we have done them. One of the other elements of our social response that I'm very proud of is that nobody can accuse the government's social response as falling prey to corruption. If you think back on all the times that the government has had to intervene with social care programs, going right back from the distribution of zinc. But we have done that. Yet, those who are vested in just painting the government as corrupt keeps carrying a narrative which doesn't accord with the facts. That is the fact on the ground. We are a government that really and truly cares. But we are now in a dilemma. If we continue with the measures, the government will not have enough resources to be able to keep doing the social safety net response. It's just a reality. If we continue with the measures, the mental health impact on the society could be irretrievable. I don't know if you have been noticing, but as children go back to school, we're seeing many more fights than before. That is a direct consequence of children not being under order and heading back into a situation where they have to be in a disciplined situation in schools. That break in education is costing us dearly. And we will have to address that. We have to get back to normalcy on that. And we're seeing it with even more confusing and illogical and irrational arguments filtering into the center of public debate. As people search for certainty and search for identity and validation of how they feel. So, they feel a particular way about a mistrust about vaccines and government policy. And so they will identify arguments that support it, validates their perspective. But this validation leads the society down a dangerous path. And so my job, Naomi, is never to be shy about these issues. My popularity is immaterial to the country's best interest. And I would have abdicated my duties as looking out for the best interest of the country if I did not continue to be the strongest messenger about vaccination and to reflect to the Jamaican people whose views might be different, that your perspectives, many of your perspectives that you are now embracing are dangerous and inimical to your own interests. So I thought I would use this opportunity. I want to thank again our partners from Northwell, in particular, Michael Dowling, the president, who made the time to join us virtually. I will bottle some of the sunlight and send it back with Sandra. And we look forward, Chris, to having the team from Northwell here to personally thank them. So it is therefore with a great sense of gratitude that I receive this on behalf of a grateful Jamaica. And again, thanks to all who made this possible.
Thank you, Prime Minister. You know, one of the very good things is that you never miss an opportunity to reason with people, especially in a society now that everybody have an opinion and there is fake news and all kinds of news. I thank you because that is an element, I think, especially when we have a wider audience that constantly watches when we stream, to be able to dispel a lot of notions, but to really reason with the people. So I thank you so much, sir. And no, you're not shy at all. That much we can say, especially in leading from the front in this pandemic. It gives me great pleasure now to call upon the Prime Minister, the Minister of Health, Dr. Lindsay, and of course, Mr. Benjamin, in doing the official handover of the equipment that has been donated to the government of Jamaica. And so may I ask you if you would be able to come to the side there. For the photographers, you can position yourselves. $800,000 worth of equipment being donated by Northwell. We thank them. Of course, Northwell Health is one of New York's largest healthcare providers. And once they heard that there is a need in Jamaica, of course, championed by our ambassador, so to speak, Dr. Sandra Lindsay, they did not hesitate. They quickly sprung into action and, of course, made this donation. Donation of over 1 million assorted PPEs, N95 masks, face shields, and also we have some oxygen concentrators that have been donated by Northwell. That's one of the, yes. For all right, thank you so much. Any other? All the more photographers, all right. The videographers, all right. All right, thank you so much, sir. Dr. Lindsay, Dr. Tufton, the Honorable Dr. Kenny Benjamin, thank you so much. And so, ladies and gentlemen, it only leaves me to thank you for joining us. Thank you to all the members who joined us online. Thank you to the diaspora who tuned in to the live stream. And of course, for all those who are here gathered at the Bustamante Hospital for Children, thank you so much for joining us. I wish you a pleasant Friday morning.